I was getting ready to go to work one day and shaving and showering and shaving. And as I was shaving, I noticed a small lump, which at the time in my neck, and at the time I thought, well, maybe I have a little cold fever, and it's my lymph node, and it'll go away. And didn't go away. And after maybe 10 days, 2 weeks, my wife said, you gotta get this checked out. So it's not just a cold. And of course, I didn't want to believe that. I wanted it to, everything to be normal. I'll tell you, when I had the biopsy done, the tumor grew, almost immediately. Within 48 hours, it was twice the size. It was a little tiny marble. It started as a marble, and after the biopsy, became a golf ball. And then that's when I knew we have problems here. I mean, something's wrong. My body's trying to tell me something, and something's wrong. After the biopsy, it really began to grow. And in our society, the most feared disease, the most dreaded words anybody could hear, test came back positive, you have squamous cell cancer. For me, it's overwhelming. It consumes your breath when you first hear it, because cancer in our society is a death sentence. What do you read? People dying of cancer, chemotherapy, the pain, this, everything happens, and your life flashes right in front of your eyes. Well, I have a lovely life. I have a great family. I have 2 young boys, and the doctor began to tell me my options, according to him. And my options, according to him, were surgery, chemo, and radiation. And he wanted to do about a 4 or 5 hour surgery, open my neck, and he began to tell me about I very possibly will have nerve damage in my face or in my neck, be on a feeding tube, and began to tell me the conventional medicine story of what might happen. When you get diagnosed with cancer, nothing matters. I mean, what matters is your family, the things you own, the clothes you have, the jewelry, the car. Nothing matters but your family. I didn't want to never see them again. It couldn't happen. And I called the Valley Cancer Institute. I called all the other institutes. I could have gone anywhere in the world. I could have had any treatment in Germany, in London, in Mexico, anywhere. And because I said, I don't want chemotherapy. I don't want surgery if I could avoid it. Each conventional doctor remarkably said the same thing. We need to do surgery, chemo. It was a mantra: surgery, chemo, radiation, surgery, chemo, radiation. And I began to realize that each doctor was a surgeon. If I go to a shoemaker, what's he going to tell me? You need shoes. You need new shoes. They're worn down. What's he going to tell me? One of your employees here, who I spoke at like many times, said, would you like me to have Dr. Wolfstein call you and talk to you? And to my amazement, because it doesn't happen too much anymore in this world, I got a phone call from Dr. Wolfstein shortly thereafter, where he spent a good 45 minutes with me on the phone. I couldn't get my ear, nose, and throat guy in Scottsdale to spend 5 minutes with me on the phone. Dr. Wolfstein spent a fair amount of time with me on the phone, invited me here to Los Angeles, and I spoke to a couple patients in the waiting room when I was waiting to see him, and it was very enlightening, made me feel better. It is not a death sentence. It doesn't have to be. It doesn't have, and I knew that in my heart of hearts that I would somehow be able to get through this in the best way possible for me, for my family, and all the way around. And so I came to Valley Cancer Institute, and I got here, and everybody was very, very nice, and I got through the first couple days, and I thought, okay, I can do this. I can do this much better than the scenario that was painted for me by many doctors across the nation. Sylvia, who does the radiation, who is an angel, she said, we've done a lot worse than this. You just hang in there, and you're good. I will take care of this. This is my job. I will get this out of your body, and within a week, it started to disappear, just go away, and you know, it's a miracle. I mean, it's nothing short of a miracle. That I should be a statistic in cancer, and instead I'm a survivor, and it's because of Valley Cancer Institute. Mm-hmm. And I am an advocate in the biggest way of what you do here. I saw it work for other patients who were far worse off than I when I came in the door. It takes time. You didn't get cancer in one day, and we're not going to get rid of it in one day. It's not how the world works. And slowly but surely, it went away. So it's a year later. I almost don't like to even verbalize how well I feel. The new lease on life. I see the world differently. I look at my family differently. I have different priorities. You know?
Thank you so much for sharing this with us, and well, I wish you my best.
Thank you.